Found in an alleyway.
It's 9 p.m. at Alder, and an unconscious teenager is brought in to casualty.
Strong smell of alcohol on his breath. Presumably his mates have gone off somewhere.
There's no one to identify him, and he appears to be drunk.
Okay. All right, so he's not told you his name?
No,
he
didn't talk to us.
Lovely. Thanks very much. Shine a light in your eyes. Can you open your eyes for me?
Of course, there a minute.
All they know about him is an ID card he had in his pocket. You know, like a bus pass, they say.
No, where this boy came from?
I don't know, to be honest.
What's the matter with him?
Ingestion.
Apparently drunk. Approximately how old do you think he is?
If we can get a phone number, we'll have to ring his...
Well, I've got an address. I brought him up off the thing, so I might get him.
Round the corner, the Corbett family are waiting to be seen. Two of the boys have been receiving treatment for cystic fibrosis on a ward upstairs. Now their baby brother has developed feeding problems. Callum is just 7 days old.
Do you want to come through? Just sit in there and Doctor will be with you in a moment.
Feeding problems were the first sign of cystic fibrosis in Dylan.
Is the puppy not well?
Antenatal tests showed that Callum is unlikely to have cystic fibrosis, but his feeding problem is a mystery. The teenager is still unconscious.
Hopefully he'll have been in the hospital before at some time, and we'll be able to get a telephone number and ring somebody and hopefully get them to come up.
His details are on the computer.
He was admitted Saturday for the same problem. Saturday just gone, yeah.
I'll go and get the card.
Well, if you can get hold of them, yeah.
You never quite know what the situation is at home. The parent will come in, where's my desperately ill child? And they say, oh, that's the drunk child that's in OBS. And the look on the face as it drops and think, oh, right.
Are you going to ring them or do you want me to do it?
I do.
Alan Higginson volunteers to track down the boy's parents.
Hello.
Across the corridor, medical registrar Peter Dale comes to look at Callum.
All right, I'm Dr. Dale, one of the doctors in casualty here. And Callum's been poorly, is that right?
Yeah.
What's been happening to him?
Everybody of the house, since he was born, everybody of the house. Brings it all back. And then he starts crying for more.
Has he been seen by his own doctors?
They came out yesterday.
Right, now have a little look at him on the bed.
Turn the lights off and get down.
Put the bed for your brother. You two look all right.
Cystic fibrosis is a progressive disease that damages the lungs.
Can't do hospital corners, I'm afraid, but...
Because it's hereditary, Peter Dale will examine Callum thoroughly to reassure his parents.
Has he been quite lively and alert?
What do you open the car with?
Is he noisy? Look inside his mouth, next to his mouth, all right. He's hungry. He's eating my finger.
Gorgeous, isn't he?
He's a lovely little thing, isn't he? Want to go back to your mum? There we go. There we are. There's your mum. Oh, I just want to see what he's feeding like now. So if we get him a bottle feed, you can see what you've been having at home.
What's he going to stay in?
Alan's found out where the teenager lives.
Well, ideally, one of his parents needs to come up and we'll... Oh, is he? Do you have a number for his foster carers? Oh, you are his foster carer? Ah, right. Right, OK.
The boy's situation is not straightforward. Alan's phone calls have revealed that he's in care.
You going to wake up for me?
He still shows no sign of regaining consciousness.
OK. I suppose better put a drip in him and get the medics to see.
Right. How about his real parents? Can we get in touch with them at all? Emergency duty team, yeah. OK.
Children's livers are still maturing, so drinking alcohol may cause more permanent liver damage than in adults. A blood test will indicate the amount of alcohol in the teenager's blood.
He's got an emergency care order out on him. Foster parents have got no legal sort of rights. It's got to be the emergency duty team. She's going to get in touch with the emergency duty team and get back to us.
Because he's safe enough where he is, so that's it.
He'll be put on a drip to replace lost fluids.
Put him to bed, let him sleep it off, and he'll be seen in the morning. And hopefully sent home again. So wait for his foster parents to turn up and let him see what's going on with him.
She has no jurisdiction over the foster mums.
Oh, really? Oh, right. Just leave him be. It's really sad, isn't it? Apparently he's done it before, but...
He should be well enough for his social worker to collect him in the morning. Callum's feed has not gone well.
Yeah, he brought it all back again. It comes out of his nose.
I think if he keeps doing this, then it's right that we we leave her anxiety a bit and just watch them overnight in hospital and see what happens with them, really.
Okay.
He'll be moved to a ward next to his brothers. Doctors hope to find a feed he can digest.
Obviously, we always just keep children under review where there's a family history of cystic fibrosis, just to make sure that we're not missing a newborn baby with it.
By 9 the next morning, Eleanor Burrows from the cystic fibrosis team has heard that Callum's in hospital.
Hey, Teresa. Hello, dear. How are you, mate? Do you know who's looking after Callum Corbett? Is it OK if I just have a read of his notes and see why he's here?
He's vomited, projectile vomit, and he's keeping nothing down, and the baby is absolutely starving.
Oh, God love him. All right, the parents are particularly concerned about the vomiting, because one of the little ones is CF presented with vomiting problems to begin with. She must be really worried.
I'm going to put the bed up first.
Callum's brothers Dylan and Jamie are halfway through their stay in hospital.
You do your front and back?
No, do your back.
Do your back first? OK.
They both need an hour of physiotherapy every day to loosen the mucus in their lungs. Next door, Eleanor Burrows has found baby Callum and his mother Sharon.
I just came to see what was going on with Callum, really. Why he's here.
We brought him in yesterday because he was bringing all his bottles back. He's been doing it since he was born.
All right.
We fed him this morning. If he takes 80 mils, then he brings it back. But if he only has bits...
Right, right. And are they changing the milk or anything?
No, he's going to have the same milk, but they're going to put thickener in it.
Is that going to be his next feed? Yeah. And then a feed after that? And if he keeps them both down?
Then he can go on.
Right. Oh, poor thing.
He can't wait since he was born in hospital and he hasn't been away from us since.
Straight out of the Corbett mould, this one. Dylan looked just like him.
Doctors will wait to see whether Callum can keep the new feed down. 5 miles away at the Whiston Hospital, 16-month-old Amy Hodgson has come to be assessed for an artificial eye, which will be fitted at Alder. Amy was born with a deformed left eye, which was removed when she was just 4 months old.
Straight away, as soon as she was born, I knew there was something wrong with her eye, because you could just tell by the size of the opening, and it never opened either. Yeah.
It just looked dead. Really was dead.
David Coppins will design and fit Amy's new eye.
Hello there. Hello there, young Amy. How are you?
This artificial eye will be based on a mould of her eye socket made 4 weeks ago.
You know what you come today for, don't you? Hey? Your eye painting.
David will match the existing iris as closely as possible.
Look at me.
Amy?
Hey. Just hold her head still if you can, just for a bit. That's
Hold it on.
That's not bad, actually. That's not bad. Right, we're going to do the white colour of the eye. Just hold her head for me if you can. That's right. Seems very unpleasant, but it's not at all. Oh, dear. You're just not quite sure what's going on, are you?
Amy's new eye will take 5 hours to make. In the burns unit, Martin Stoll is waiting to go to theatre.
There you go, darling. Cocktail a la Francis.
Yeah.
Thank you.
This will be the latest in a long line of operations for Martin.
A teenager has been electrocuted and another has suffered burns.
A year ago, Martin was badly burnt by an overhead electricity cable while playing on a railway line.
Martin. We're in theatre, sweetheart.
Surgeon Richard Bryson was called in to repair the damage.
As that's actually bare bone, we need to move some scalp to cover it.
Martin was not always an easy patient.
What's the matter with you? You are well. You've lost weight, but you're not ill.
There were still 2 holes in Martin's scalp, and Richard Bryson needed to create enough skin to cover them.
That'll go under there.
He inserted a silicone bag underneath Martin's scalp. Over the past 3 months, the bag has been gradually pumped full of saline to stretch the undamaged skin on Martin's head.
This is my 10th operation. I'm just hoping for the best, that it gets fixed properly.
You ready to go?
Okay.
In today's operation, the bag will be removed from Martin's scalp, and Richard Bryson will use the stretched skin to cover the 2 remaining areas of exposed skull.
Yes. I think we'll need to have him on his back, I think. It's all right, he won't know about it.
Put you down, okay? We just put you down.
Good.
Okay? Just put you down, okay? And pretend you're blowing the balloon, okay? There we are, that's it, okay? You want to give him a kiss now? And she'll take you out of the wall. Thanks a lot. Thank you. Okay?
Okay, cheers.
At Whiston, David Coppins is painting the iris onto Amy's artificial eye.
How long would it take to paint it?
Well, surprisingly, not that long after we've finished this stage.
Is it really hard to match up?
Adults are a lot easier than children, for the obvious reasons that they don't move when you don't want them to. But generally speaking, it depends on the person, really, but no, it's not too difficult. It's just patience and time. I guess I look in one place just long enough, just long for you to see. Yeah, okay.
The hand-painted iris will be fixed onto an acrylic base moulded to fit Amy's eye socket.
This one's not to be taken out.
Up till now, the socket has been gradually expanded with clear acrylic balls custom-made to fit.
It just doesn't bother her at all.
No.
Just now and again, she must get a little fed up. She's got nothing to do and she'll pop it out. You know, put her finger off the back one, pop it out and play with it. She used to find it quite funny, didn't she, when it'd roll on the floor? It'd be like a little marble for her to play with.
And then once when we come out of Alder, we'd only just come out, she'd popped it out and stuck a dummy in.
David handcrafts the eye to get exactly the right shape. The operation to fit Amy's new eye will take place at Alder. Martin's operation is well underway.
Right.
Can you bring the hand tray for me, please?
First, Richard Bryson needs to make an incision large enough to remove the saline bag.
There we are.
The picture. The birth of the baby.
There it is.
Very good.
Thanks very much.
Thank you.
Now, I want to get all this grotty tissue out of the way. There's a bit of residual dead bone from the original burn. So we need to take that off. So I'm afraid we're going to use the hammer and chisel.
Which are small bone chisels. Do you prefer one of those?
Yeah. We must remove all dead tissue. If we don't, it'll just cause trouble later on.
For Callum, it looks like the thickened milk formula might be working.
Die staat 40 mils of the second ball. As me zeg op zo.
The bill look be out tomorrow. Yeah. Okay, we're still going to be up and down seeing the other two. We're hardly ever at home. I'm going to go home to sleep now. And well, the milk's done the trick. I can't wait to get them all home. First time we've all been together was 2 days ago. And that was in here.
Callum's feeding will continue to be monitored.
Now,
Martin's still in theatre.
you can see what happens to this, hopefully, that will now stretch right the way over and cover all those areas that we wanted to over here. Stitch. This is the tedious bit now. This is the stitching. Hook that up.
Martin was lucky to survive the 25,000-volt shock without brain damage.
The only possible damage would have been from the initial electrical injury, but he hasn't shown any evidence of that at all. So, are you raising your eyebrows there, Angela? I think he was like this before. There we are.
Once Martin's hair grows, the scars on his scalp won't be easily visible.
There he is, in all his innocence. I think he'll be pleased with that. I hope so. Certain patients, you know, whom you do have a lot to do with over quite a long time, really become almost friends, and you develop, well, I think it's a very special relationship with them, really. And, well, that's what medicine's all about, I think.
Daddy, what's time we're doing today?
There she goes.
Callum Corbett's feeding has improved so much he's being allowed home.
And when you've all finished, we can go home.
No.
Yeah.
No.
Oh, well, you can all stay here then.
Yeah.
and I'll take him home. He's going out. I can't wait.
His brothers, Dylan and Jamie, will remain in hospital for another week to finish their treatment. And in 5 weeks' time, Callum will return to Alder to have the final test for cystic fibrosis. In the burns unit, Martin Stoll is coming round from his operation.
I think it's lovely. I think he'll be quite pleased as well about it. The holes have gone and there's only a tiny little bit of bald patch left now.
His mother, Nagiba, has been at his side through all his stays in hospital.
I have been feeling like, God, it's never going to end. It's never going to end. It's been a long year and I'm tired, actually. It's a very hard lesson to learn, really, not to go on a railway line. But he's learnt it.
Today, at Alder, eye specialist Arvind Chandner will fit Amy Hodgson's artificial eye.
Hi, Amy, how are you?
Mr. Chandler?
Hiya. Okay, so what we're going to do today is to look at the socket again, measure its growth, and then take an impression again. And Mr. Coppins would have already made a prosthesis to go into the orbit. We'll also check her whether she needs glasses for the other eye. Okay, good. So have you signed the consent form?
Yeah.
Great. Excellent. Right, you hope.
Okay,
See you later.
see you later.
Bye.
Bye.
Bye-bye then.
Bye-bye. We've had it for 16 months with nothing. To suddenly have like a baby that's got 2 eyes. It's other parents just expect, you know, because they see their children like that all the time, but it's a big thing for me and Barry.
Just gonna start making her look normal, you know what I mean? Like, people won't stare as much, will they? Because, like, a glance, you think, oh, there's nothing wrong with her, you know? Whereas, when she got the clear one in, you get a glare off it and that, like, you know? It's like a cat's eye, you know? But, this one will be great. We're just waiting to see it, though, you know.
In the outpatients clinic, 4-year-old Samantha and her parents wait to see cancer specialist Heather McDowell.
Everybody keeps looking and saying, what has been the problem with this child? They think it's all a con, don't they?
In the past month, Samantha's had surgery to remove tumours growing inside her ovaries. The ovaries themselves were removed, leaving her infertile.
The tricky stuff comes with trying to preserve the ovarian tissue for future prospects.
A fragment of ovarian tissue was saved and frozen. Fertility specialists hope to use the preserved tissue to produce eggs using a revolutionary technique. They hope this might help Samantha have babies in future. But today, Samantha's parents are more anxious to find out whether her second tumour was malignant or benign.
Right, in you come. OK, how are you? Right, the second tumour that was taken out, basically it's all non-nasty, all right? Yeah. So it's all benign.
Oh, that's lovely.
Well, it's good news, as I say.
It's definitely good news.
But there has been a
that's our main
price.
concern.
As regards the bit of the ovary, her tissue, of course, would be frozen for at least 10 years, hopefully, before she wants it. So
You never know anyway. For 15, 20 years' time, you don't know what they can do. So.
OK, that's
great.
it then.
Thank you very much.
All right.
Safe
Bye-bye.
You can be faster.
I felt, you know, that everything was going to be all right. I just wanted them to say, yes, everything's fine.
You just need that.
You need them to
final word,
reassure you, yeah, because they're the people in the know, obviously. Yeah?
One more. Are you ready?
Go on, then.
Are you ready?
That
other stuff can come later, can't it, eh?
Samantha is one of the youngest patients to have ovarian tissue frozen, in the hope it will eventually help her to have children.
Slow down now. We're going.
6 weeks ago, 10-year-old Kelsey Finnegan lost her voice.
Ready? Do you want to come in?
Today, she's at Alder for her 4th speech therapy session. Despite a breakthrough last week, she's come back with hardly any voice at all.
You're not kidding.
Siobhan McMahon has to find out why.
So, come on, Kelsey, what's happened to that voice of yours? I don't like using it.
Right. But you can use it, can you?
Yeah.
Would you like to have this whispery voice all the time? No, because that will be a bit of a nuisance when you go back to school, won't it? All right, let's hear a bit of your proper voice. You can tell me what you were doing at the weekend.
Played on the motorbike and sulked.
And what?
I was sulked.
Sulked? Why were you sulking?
Because I wanted this little puppy and won't let me have it.
But you've already got lots of pets, haven't you? I think it's a little bit cheeky to only use a loud voice when it's about something that you specially want. I don't think that's very fair on your mum. No, I think you should try and do it all the time. If you have such a quiet voice for a long time, people will get a bit fed up of listening to it. Like your mum might get fed up of listening to it because it's harder work. Do we agree that you're going to try and use a proper voice all the time? What do you think your mum should do if she hears you going back to that whispery voice?
Tell me to stop and use my other voice.
Yeah, and you're going to take any notice of her? Is that a promise? Yeah?
I'll be quite made up when it's all over and done with. Just get on with everything else then.
Have a quarter of cola cubes.
Cola cubes.
Now she can speak, and she knows she can speak. It's just her doing it. And she knows she can do it, so she's just got to get on with it.
What I was trying to do quite carefully today was to make her realise that it is up to her. It's not that she needs any other form of treatment really, but that she can produce proper voice and that she should be doing that because there's no reason why she shouldn't be.
So what was it like? Try and explain what it was like when you first started.
Everyone in school was skitting me.
Skitting you?
Laughing at me. Did you read him?
Kelsey will continue with speech therapy until she learns to use her voice with confidence again. To have her new eye fitted, Amy Hodgson will have a general anaesthetic. The operation is a quick procedure that doesn't involve surgery.
So I was removed in July '96 when she was 3 months old.
Arvin Chandner has been treating Amy since she was born.
So here we are with the X-ray. You can see that the one eye is significantly different in size from the other one. It's very, very small. We decided to remove this eye because it was a sightless eye. There was no evidence at all that there was any sight, and the front surface of this eye was opaque or frosty. And so after discussion with the parents, we removed the eye, and since then we were very successful in putting larger and larger balls inside that empty socket now to see whether we can enlarge it. Okay, we started with this size, and slowly we have progressed to this size, and today this is the first time we're actually going to fit a designed artificial eye which is going to be matched in color to the other eye.
First, he wants to check Amy's other eye.
And I'm looking at the area which helps to keep the pressure under control, the drainage angle, and it is very abnormal. The major effect is that the drainage angle in the eye gets blocked up and the pressure rises in the eye. And if the pressure rises, a condition called childhood glaucoma, in which can damage the nerve at the back of the eye and your sight at a later stage. You have to be careful to pick it up at an early stage before you can treat it, but you can treat it. So David has got this made up, and this is a single artificial eye matched to the other eye.
Even if the eye is a perfect fit now, it'll have to be increased in size as Amy grows.
Yes, so there is the artificial eye now matched and fitting very comfortably within the present socket. And we need to see how it looks with the other eye. So now you can see that there is quite a lot of symmetry between the two eyes. So this is the first time we've been able to fit this in. And looks it will retain well, David, do you think?
It retains very well, yeah, it does. It's going to be more difficult for her to close that eye anyway,
Yes.
Because we're trying to expand it. So it's designed to sort of over-expand and make the eye feel more full.
So there we have it. We have Amy's new eye here, and her other eye, which has got some abnormality, but she's not suffering from it in any way at the moment. Well done, David. That's excellent.
Amy should be able to go home later today.
Would you want some clean ones now? Take them off for me and I'll get you some.
It's now 2 days since Martin Stoll was operated on by Surgeon Richard Bryson.
Shoe, please. You can change your bed when you're at home? No, I didn't think you would.
Yeah. Nice
Go
one.
on then, you put them on.
I can't put them on. It's
Why?
hard to.
I'll show you.
Go on then.
Go on there, get your pillowcase.
I don't have to do it. I'll put one on then.
You have to work while you're here, Mars.
I'm supposed to be a patient.
Yeah, and there's nothing wrong with your hands, is there?
Oh, yeah, I broke my finger.
I am sure you have. I'll have to tell your mum you've done this. Will she believe me?
I don't even know how to put them on, you know.
Well, you're learning today. Patience. You haven't got any, have you?
That's why I don't like doing it.
Yeah, so it doesn't slip out. Chuck it up the little flap.
Sorry.
Go on then. And go and get Fran and have your head done now.
Well, we'll go on to Martin, hopefully.
Shall we go to Martin?
Right, hi. How's it all feeling?
Sore.
Sore. It doesn't hurt too much on the top, does it?
No.
Have you seen yourself in the mirror?
Yeah.
What do you reckon?
Good.
Good, fine. Would you like to go home?
No, yes.
Huh?
I'll see.
You'll see. All right, I'll ask him, Mum. OK. Right. I would think if we take the stitches out on...
Next Thursday.
Monday, I'd have thought. Yeah? Monday? That'd be all right? Yeah, go on. There's nothing to it, OK? Look after yourself. Fine.
Good.
Good, thanks very much. Right.
Martin will need one more operation to complete the work on his scalp. A week later, Kelsey regained her speech. She also gained a chinchilla. Callum continues to do well. He's had the test for cystic fibrosis. His parents are waiting for the results. And as for Amy Hodgson...
Isn't that wonderful? She's got you. Yeah. We had to keep her awake. We couldn't let her go back to sleep.